medicine, so that is a relatively unusual example of a degree which is quite similar across different universities, right? So therefore, why Oxford?
I think the course structure in Oxford really lends itself to helping you be an independent thinker and not have to regurgitate facts as I would say most of medicine is taught, especially me now going into my third year, my FHS year, or in other universities intercalation, where I get to choose a project of my own choosing and I get to pursue topics within the biomedical field that really interest me. I'm working in the Department of Pharmacology and I'm helping my supervisor develop a drug to treat catecholaminergic polymorphic ventricular tachycardia. It's a real mouthful, CPVT, and we're targeting randine receptor 1s in the heart.
At some university medical schools, you work with patients earlier on, right?
Yeah.
Whereas at Oxford, the clinical side of things is after your first 3 years, is that right? So why would you choose that approach of not seeing patients until a little bit?
Yeah, I think, and it took a bit of convincing for myself as well, because I always liked the patient-facing side of medicine. But you really have to subscribe fully to the Oxford course and the way they do things here. It's all about building those scientific foundations that I think put us in good stead for when we do face patients eventually.
Right.
The fact that we're able to work it out from first principles, and not only does that help us develop a suitable treatment plan for the patient, it also helps them understand it a bit better.
Okay, fantastic. Now, that approach of having 3-year medical sciences and then a more clinical focused approach to medicine is quite similar at Cambridge,
Yeah.
right? So I asked you why Oxford, why not Cambridge?
That's a funny question, because I actually applied to Cambridge first and got rejected.
Oh, me too.
Yeah, well, I took a gap year and reapplied to Oxford.
Right.
But I think, like you said, there's not much really setting them apart in terms of course structure, because they're both are very traditional medical courses, both have a very similar format.